We are back to Health, Hygiene and Wellness. We are still discussing about cancer. Remember, it is February and it's the month for awareness of cancer. And in this second half, we are going to discuss about prostate cancer. I'm having Dr. Silas in the building or in the program to help me demystify more about these cancerous diseases. Now, Daktari, let's just run it over. Is prostate cancer curable?
Prostate cancer, much curable. It's one of the, I can say, the best cancers, because if you compare
Yes.
all the cancers, the progress of the prostate cancer is slow, you understand? And it doesn't just start with cancer. It starts with the enlargement of the prostate, which will always give you a sign, maybe through obstruction of urine, frequent urination, and anything that touches your urine, people always come to the hospital. So you can it's a very preventable cancer by just getting the removing the whole prostate, and you are okay.
Maybe for the sake of our viewers,
Yeah.
Where is the prostate found, or what is the prostate?
Yeah, the prostate is an organ that is found in men. Women don't have prostate,
Yes.
just like the cervix. We said last time it's only women who have the cervix.
Yes.
And also it's only men who have the prostate. So the prostate is just below the bladder, inferior to
Yes.
the bladder, and it's an organ it's a sexual organ actually. It actually supports the semen that is produced from a man. So it's a sexual organ, and not a very, very important sexual organ, because it doesn't produce the sperms, but it just produces actually part of the semen. Yeah, it's a gland that produces part of the semen. So I know people will start asking, when we remove this prostate, can we continue with our life as men? You will. You can give birth to children without the prostate. Yeah, so it's an organ that can be removed. I know others will say now, can I be removed the prostate when I'm still young so that I don't get cancer? It is important for you to have the prostate because it's a gland that is important in your sexual activity. But whenever you are getting old, we can remove it if it is showing any signs of cancer, and you will still continue with your sexual life. Yeah.
Just for clarity, so it means that when treating prostate cancer or when affected by prostate cancer,
Yeah.
you don't become infertile.
No, you don't become infertile, because the fertility hormones or the fertility hormones, they come from the testicles. So if you want to render somebody infertile, you actually have to tamper with the testicles. That person will be infertile.
All right.
But if you tamper with the prostate, that person is still fertile. Yeah, so the prostate is just there to boost actually the part of the semen. It produces some hormones or maybe some liquid that is added to the semen alongside the sperms, that now helps the sperm to move to the uterus for fertilization. Yeah.
And can a urologist
Yes.
detect prostate cancer?
Yeah, not necessarily a urologist, even a nurse in a dispensary.
Wow.
Yes, not necessarily a urologist.
So it means your urine also carries some molecules for prostate cancer.
Not the urine, not the urine. It's not the urine.
And how can a nurse how can a nurse detect that?
Very simple. If somebody comes to us in a hospital,
Yes.
and they want to screen for the prostate, there are several methods of screening for the prostate. There is what we call digital rectal examination. Very common, very old method that was used by even our ancestors, whom we never saw before we developed these other tests like ultrasound. What you do, you just examine, it's a bit uncomfortable because you just examine a man, but you go through the anus, and maybe you palpate, you check the prostate. It's not painful. You check the prostate, the size, you are able to know if it is swollen, you are able to know if it's cancerous. Imagine, it's very simple. That one, even a nurse in a dispensary can do it. The digital rectal examination, all medical personnel, clinical officers, nurses, maybe medical officers, surgeons can do it. So it is very simple. It just needs a small skill for you to identify that a prostate is swollen. Secondly, for the higher level hospitals, where there is an ultrasound,
Yes.
you can do an ultrasound of the prostate and you identify it. So you don't need to see a urologist. Thirdly, there is also the PSA test, the prostate specific antigen test. Now, the prostate specific antigen test looks for the cancer now. Whatever I was telling you, digital rectal examination looks at the enlarged prostate. Once you pick it, you now push it forward to see if it is cancerous or not. But whenever you do that digital rectal examination, which many men fear, but it's very simple, you can easily know that there is cancer because there will be a lot of pain. And sometimes you cannot even be able to enter the anus when the prostate is cancerous because it's very painful and uncomfortable. But if it's not cancerous, you are able to do the procedure comfortably. So you just go to your nearest dispensary and people can identify if you have a prostate swelling that is cancerous or not. Yeah.
Now, depending on the location, differentiating the location between the colon and the prostate,
Yes.
you find that the prostate is just located far away. It
Yeah.
doesn't have any contact with whatever you take into the body.
Yes.
Now, how comes that cancer develops in the prostate and even it swells? What causes that?
You know, the prostate is a gland. The colon is an organ.
Yes.
They are different. So a gland, there is the structure of a gland is far much different from the structure of a colon.
Yes.
Even if they remove the colon and put it here and the gland, they put it here, you realize that they have a different structure. So that structure of a gland, and you know, the challenge with a gland is just like the breast. You know, the breast, they have mammary glands.
Yes.
You see, the thyroid, it's a gland. So glands tend to develop cancer more than any other organs in the body because their cells tend to change shape anytime. Today, whenever you age, you realize that your prostate becomes big. But whenever you are young, your prostate is small. So just by virtue of changing shape,
Yes.
it means there is a risk for cancer. Secondly, there is always a risk for mutation. These cells can mutate, the DNA can be changed, and somebody can develop cancer. Thirdly, is about inheritance, because we've seen families where there is prostate cancer being inherited from one parent to another. So that's why there is that risk. So the risk is basically about DNA, nothing else. So if you have a change in your DNA, the cells start changing, it enlarges, then it moves to cancer. Yeah.
And you find that when women themselves can do their physical test for breast cancer and detect the lumps in their breast.
Yes.
Can men also find a way they can do that for prostate?
The beauty about the prostate is that you can identify if a prostate is enlarged through your urine. There are these men, you know, who don't care, but there is a problem. You know, they go to the toilet, they are moving back, they go again, they are moving back, they go again, and sometimes there is dripping of urine. You will find they have wet pants. They are very uncomfortable. They can't stay in a meeting for so long because the pants are wet. The urine starts dribbling. That is one sign. So the prostate always gives you symptoms through urine. Number two, if you start having frequent urination, you know what I'm saying, you go, you come back, you go, you come back, there is a problem with your prostate. Okay, you might have diabetes, you might go to screen for diabetes, but it's not there. You might go to screen for UTIs, it's not there. So probably the next thing you need to go for is the prostate. So those are the things people need to look for. So there are obvious symptoms. Then there is urine blockage. One day you wake up, your urine is not flowing. The whole day, it pops out. Then the next day again you wake up, it's not going off. So there is a problem with your prostate. Blood in urine again. If you have blood in urine, there is a risk for prostate cancer. Then pain, low abdominal pains. If you have low abdominal pains, frequent low abdominal pains, especially when you urinate, there is pain. Whenever you do maybe any kind of exercise, there is pain. There is even pain after sex. You know, those are signs of the prostate. Could be having a problem with the prostate. So you can easily identify whenever the prostate has a problem. especially at early stages. But when it's late, again, the symptoms go off because the cancer has spread to other organs. Yeah.
Now, Daktari, what causes this prostate cancer? Just like the other ones, I know you'll talk about lack of exercise and all that.
Yeah.
But what is unique that causes prostate cancer?
Prostate cancer, as I said earlier, probably it has a genetic predisposition. If you have one family member, maybe your grandfather, your father, one of them had prostate cancer, there is a high risk that the second generation or third generation somebody might develop cancer because it's a cancer that moves in families also. Number two, I know there have been myths and misconceptions that people who, I don't know, people who have one wife, people who don't have sex regularly, they might develop prostate cancer, but that's a myth and misconception. I know I come from the village where these things are talked. So
I know
that's why
many of the viewers would like you to confirm that it's true lack of sex causes prostate cancer.
it's not true. It's not true. I know a lot of people are even doing a lot of research on it, and they are trying to show some statistics, but most urologists have gone to most conferences where they are urologists and they don't confirm that because it's just like any cancer. It has no, a prostate gland has no difference with the thyroid gland. So it's a gland. Just by virtue of being a gland, it gives you the risk for cancer. But there are obvious things that people don't want to hear. Your diet, your smoking status, your alcohol status, your exercise, the very simple things that people don't want to hear. They are the ones that are causing prostate cancer. And also age. Whenever you start aging, there is always degeneration. And the best thing when you start aging, whenever you celebrate one birthday, celebrate it with a prostate test. Because it is giving you more risk to prostate cancer. Because the degeneration, natural degeneration, nothing else. In fact, the percentage that people inherit from prostate cancer is very low, not more than 20%. But most people who develop prostate cancer, they just had an enlarged prostate that was not attended to, that later on it was benign, but moved to be malignant. Yeah.
And how long can someone take to detect that my prostate is enlarged or I have prostate cancer?
Yeah, a very good question. An enlarged prostate can take up to 5 years before it gives you symptoms. And it can also take another 5 years before it gives you cancer. So you can see it's a whole 10 years. That's why people who are having cancer are from 65, 70 years, 55 there. This prostate started enlarging maybe at 45 years. It went to 50. At 55, 60 years, that's when it's
becoming cancerous.
So you can imagine the whole journey of 10 years and you never picked it. 10 years. And you never picked it.
That's why it's more important to go for screening.
Yes, you need to go for screening. We just give you drugs that will reduce the size of the prostate and it will never move to cancer. If it's very big, we'll do the surgery, remove it, and probably will be okay. Yeah.
And what are the common signs for prostate cancer that can be detected earlier?
Yeah, I think I've mentioned many of them. The first signs are urine problems. There is urine blockage. There is, the prostate lies just below the bladder. So that means it reduces the size of the bladder or it interferes with the movement of the bladder. So you will not retain urine for a long time. So you might have tripling, you might have incontinence. Whenever you want to go and urinate, just after a few minutes, the urine comes out even before you reach the toilet. That could be a sign of prostate enlargement. Another sign is bleeding, blood in urine. Another sign is maybe loss of weight. There is anemia, all those symptoms. Yeah, there's abdominal pains, abdominal swelling, because the bladder, whenever it has urine, it will swell. And whenever the prostate is big, it will also swell. So there is that abdominal swelling. And maybe other symptoms would be pain in your bones. There is, the prostate also has a risk for spreading to the bones.
Yes.
Yeah, so that's why you'll have fractures. Somebody might come to you, they have a fracture, and yet it's coming from a prostate cancer that has moved to the bones. So these were those who develop who slide at home and break their bones, it's good to check their prostate. It could be cancer. Some other people might be having those symptoms. You know, the prostate is just near the colon, so there is no passing of stool. There is constipation. So because there is obstruction in the system of stool and urine, there's obstruction of urine, there's obstruction of stool. There might be blood in stool also. There might be also urine incontinence, whereby you can't stay for a long period with urine. So those are the symptoms, just rotating around the region of the prostate. Yeah.
And how do you treat it, Daktari?
Treatment of the prostate is simple. If your prostate is enlarged and it's not cancerous, we can just remove it. Or if we can't remove it, there are some drugs that can be used to
Revive it.
or maybe not to revive it, but to reduce the size of the prostate. Secondly, if it's cancerous, now it depends on the stage of the cancer. If it's stage 1, stage 2, if you remove the prostate, you remove with the whole cancer. But if it has moved to other organs, now you can do chemo, radiotherapy, and other very invasive methods and very expensive methods that can be used. You've had people injecting direct to the prostate. There are some drugs that you inject to the prostate direct and they heal the prostate. So if it's cancerous at early stages, and we encourage our people to come to us, especially men. You know, men just walk around and they don't go to hospital. They do a lot of politics around, but they have pain. They're just hiding their pain. So they need to come. Even me, I'm a man. I'm hoping when I get old, I'll be screening my prostate every single birthday. Yeah, so whenever you celebrate your 50 years, celebrate with your prostate. Yeah, because the prostate that has carried you all these years, you know.
And where is surgery required? Where is necessary?
Surgery, as I've said, surgery is required in early stages of prostate cancer. Early stages of prostate cancer. Early stages of, there's one what we call benign prostatic enlargement. So if it is benign, we can do surgery. If it's cancerous, in early stages where it has not moved to any other organ, we can remove it. And also surgery is required when you want to identify if it's cancerous. So when we remove the prostate, we can take it to a laboratory somewhere for biopsy so that we can identify that this is prostate cancer. So a doctor will see you, tell you this prostate is enlarged, but I need to do surgery so that I can get it out and do a biopsy. And this biopsy will tell me if the cancer was just confined in the prostate or maybe it had moved to the other organs.
Yes.
Yeah.
All right.
Yeah.
Now, Daktari, if I have undergone the treatment for prostate cancer, how long am I going to live?
It's God who determines. But you will live long. You will live your entire life. Maybe there's another different cause of death that will come to you. But once we are done with you, we've treated the prostate cancer, you are good to go. You know, the prostate, as I said, is a gland. And it's not a very, very important gland to your body because it just helps you a little in your sexual life. So when we remove it, we go away with it, you continue with your life, and it will not affect you. But it depends. Well, sometimes there is a risk for recurrence. You know, there are these slow cancers that you remove the prostate, but they had already moved to the lymph node. And maybe you didn't pick it. So they come again and they affect another organ. Number 2, there are people who have a risk for a cancer of the prostate, but a different cancer. Maybe this cancer came from a different organ and it came to the prostate. So that organ had cancer, but it was coming slowly. So sometimes in Kenya here, especially in a low resource setup, you miss to identify that cancer. So you just deal with the prostate because it's the most obvious at that period.
Yes.
So by the time you realize the other cancer has grown, it affects this person again. I know there are people who are asking themselves, I had prostate cancer, I was operated on, my prostate was removed. Later on, I was told my bladder had developed cancer. It could have spread, but we needed to do a biopsy of the bladder again to know that there is cancer. But also on a medical ground basis, you couldn't do surgeries for all the organs, you see. So you wanted to remove the prostate, and probably you thought this prostate was the only organ that was having cancer at that time. Then also, there are some people who just have a genetic predisposition themselves, not from the families.
Uh-huh.
There is a genetic predisposition of getting cancer. So they get cancer of the prostate. After that, they get cancer of the colon. They get cancer of the bladder. It spreads. So there is always that risk. But it's a very, very small percentage. So that does not discourage the other population to come for prostate screening so that we can prevent the cancer.
Now, Dr. Silas, what are these some of the life activities that we should avoid to avoid getting a prostate cancer as men?
Yeah, I'm an ambassador of stopping alcohol, not alcohol, but tobacco in men. Tobacco is a high risk for cancer. Tobacco, any form of tobacco, including shisha, including this, the ones this was this usually put in their nose. I don't know. They call it keraigo.
Yes, yeah, that one.
Yeah, there's keraigo. There is just cigarette smoke. All those things are a risk for cancer. You know, you enjoy them in your youthful life, but later on, even smoking bang is a risk for cancer. I know there have been controversial discussion that bang usually is used to treat cancer, but smoking bang is a risk for cancer. Yeah. So we've not done enough research to show that it treats, but we've done enough research to show that it causes cancer. So that's why people need to develop their lifestyle. Number two is also that people have to also do exercise. We need to move out from the motorbikes, the motor vehicles, get out, go to the gym, walk around, take natural foods. Those are the most important things. Plus, avoid alcohol. Yeah.
Now, Dr. We've reached the end of our discussion about colorectal cancer as well as prostate cancer. Now, being a month of awareness about cancer, what are your remarks? What remarks can you make about these two cancerous diseases before we part? My
remarks are people need to come for screening. For sure, we've the Kenya has trained many doctors. Kenya has trained, we have urologists, we have oncologists, not like the later years where these specialists were not there. And we are trying to even open up cancer centers where people can come for treatment. So we really need to encourage our people to come for screening. Colorectal cancer, go to your nearest dispensary, discuss with your nurse if they can do a digital rectal examination for you. If it shows any other problems, we'll escalate to do even an endoscopy. Number two, for prostate cancer, people, for the colorectal cancer, we can do endoscopies and other things. So just bring yourself. Whether you are sick or not, don't wait for the symptoms. Just come to us whether you are sick or not, and we'll help you to prevent cancer. Yeah.
Thank you so much, Daktari, for making time to be with us in this program. I hope that our viewers have found this program very insightful and educative, especially for men in prostate cancer. All right, we've reached the end. My name is Barasa Saenyi. I've been hosting Dr. Silas Wambulwa from Kitale Referral Hospital. Till next time, thank you so much for watching. Bye-bye.